So where do you see pasteous lines? Welcome back to the Kerala PGMEE 2015. Pasteous lines, as what you can see here, are the classical features which you see whenever there is any scarlet fever. Streptococcal infection is what you need to remember. Erysipelas is streptococcus. Staphylococcal scalded skin syndrome is because of exfoliative toxin. Erythrasma is Corynebacterium minucidum, famous old question. Green nail syndrome, as what you can see here, green nail syndrome it is called. It is due to Pseudomonas aeruginosa is what you have to basically remember. Then why xenon provides a rapid induction and recovery? Mainly because the blood partition coefficient is very low. The partition coefficient is also called solubility. And any inhalational anesthetic with a high numerical partition coefficient, then it will be slow to saturate and hence induction will be slow. Whereas xenon has got a very low partition coefficient. So that is the reason that lead to development of faster and rapid induction. You want to say C? What is there in C? That is not the underlying cause. The underlying cause is solubility, which comes from blood gas partition coefficient. Local anesthetics kaise kaam karega? Local anesthetics basically will be the sodium channel blockers, and that will block the membrane depolarization, which is underlying cause. Modern anesthesia machine made. What are all the safety factors? First is pin index. This man's wife you don't bring and party with the date with the other man. Because of the pin index system, only right cylinder will fit the right part of the machine, tubing. Color coded cylinders, unless you are a color blind anesthetist. Then non-written valves. Then how is oxygen flow meter? It will not be upstream but it will be downstream. Upstream क्या होता है, downstream क्या होता है देखेंगे. देखिए air nitrous oxide. Suppose if the oxygen is upstream, क्या हो जाता, आउटलेट से खाली नाइट्रस ऑक्साइड जाएगा, ऑक्सीजन नहीं जाएगा. That is a potentially dangerous situation. Suppose if the oxygen is downstream to the nitrous oxide, then it is considered to be the fail-safe method. So then oxygen delivery to compulsory hoga. So that is the natural protective mechanisms which are being provided. Levobupivacaine, compared to regular bupivacaine, it is less cardiotoxic. I told you na, end tidal carbon dioxide. Every entrance they are asking one question. EtCO2 kya hota hai? Initial notch which you see in EtCO2 curve. When the patient comes back from the muscle relaxation, there is a notch in the EtCO2 curve. Recently, it was asked in one of the entrance exams, Comet K and all. So that is the reason, doctor, you have to carefully review. So it has a very high predictive value about the spontaneous recirculation is what you have to basically remember. So EtCO2 is a very hard topic, doctor. Capnogram, you have to review. One question on alcohol intoxication in psychiatry, without that there is no paper. 80 to 100 mg of ethanol per deciliter is considered to be the sign of intoxication. Malignant neuroleptic syndrome, there is a muscle rigidity and high temperature. Pseudo symptoms of pregnancy in non-pregnant women is called pseudocyesis. Very easy question. Lorazepam का adult dose होता है 0.5 to 6 milligram. So initial dose is 1 mg orally 2 to 3 times. Maintenance is 1 to 2 mg orally 2 to 3 times. The daily dosage vary between 1 to 10. Fear of high spaces is called as acrophobia. Psychiatric questions are relatively very easy in this Kerala paper. Most radiosensitive tumor is seminoma. Even a LKG, UKG entrance aspirant also will answer it. This is, unless you are a prepared student, you can't answer this. Radical external beam radiotherapy dosage kitna hota hai? If you may be knowing for cervical cancer. Head and neck malignancy, unless paper is out, you can't guess. So you have to still guess 70 gray. Right? So what are the indications for brachytherapy? Everything I leave the literature for you. Then for limited stage small cell lung cancer, how do you basically treat? So you can give chemo and radio, chemo alone or surgery followed by chemo or chemo radiation and prophylactic cranial irradiation. Generally surgery has no role in case of small cell cancer, as all of you know. Then which comprises a particle radiation out of all this? Proton therapy, proton beam radiotherapy. With precision it can be able to deliver the radiotherapy, hence called the particle radiation. Brachytherapy is an established treatment for cervical cancer, esophageal, bronchial malignancy, but not for retroperitoneal tumors. Kahan brachy lagate? Already retroperitoneal means behind somewhere. Then which is incorrect about sliding hernia? Sliding hernias, whenever they contain large bubble, they are of the indirect type is what you have to basically remember. Then which is incorrect about Spigelian hernia? Spigelian hernia basically passes through the abdominal parietes. So typically it will be passing above the arcuate line, not below. That is the nature of Spigelian hernia. Desmoid tumor. This is an example of an abdominal MR which is showing the presence of a desmoid tumor. It is more common in women, and Gardner syndrome is erythematous polyposis with desmoid tumor. It can undergo central myxomatous change. Generally surgery is the treatment. Only if it is recurrent disease, then only radiation is the treatment. That's the point you need to appreciate. Sportsman's hernia. What is the most useful diagnostic tool in sports? What is sportsman hernia? It is also called epileptic pubalgia, is a name given. Hockey hernia, hockey groin, Gilmore's groin. Kerala PG medical entrance surgery questions are all typical pickups from the Bailey and Love. Bailey and Love में boxes रहता ना, straight pickups. Boy है तो girl करेगा, twice है तो 4 times करेगा, rare बोले तो common करेगा, antonyms मालूम होना है, तो then you will, that is how MCQs are set. If carcinoid is most common, they will make carcinoid is rare. Do you think so? They will ask like a TV reporters, how do you feel about this failure in the exam? So, groin pain in athletes will be there, and a dilated superficial ring will be there, very common in football and ice hockey, and it is the MRI which will help you to diagnose. On MRI, what will help you to diagnose? On MRI, hyperintense T2 weighted signal involving the anteroinferior aspect of the pubic symphysis will be typically found. Postoperative complications of inguinal hernia. Doctor, what is Bessini's repair? What is meant by the different types of repairs you must know. That is one more question on hernia. So, but this question, what is the answer? Basically, Scholdice's repair is the best repair because of the lowest amount of recurrence. Scholdice's repair basically has got a low recurrence and produce the most enduring results. It is considered to be gold standard in the repairing process, and recurrent rate is only less than 2%. So what is shoulder is repair, everything I leave the literature for you. Then hernia development is more common in which situation? Actually in smokers, in elderly, in pregnancy. This is not the actual question Kerala paper. Kerala paper may option C was obesity. But obesity also is a predisposing factor. This is the reason I have slightly changed it for your purpose. Men versus women I made it. So original question was obese patients was the option given. It is more common even in obese patients also. Incarcerated hernia means what, doctor? Irreducible painful hernia with a vascular compromise. Early dumping versus late dumping and Billroth type 1, type 2. 100% you should be sure when you go for exam. Chalo. What is meant by early dumping? After you have done the Billroth, within 15 to 30 minutes from the ingestion of the meal, all that osmotically active substances jump into the small intestine, and that will cause nausea, vomiting, bloating, cramping, diarrhea, etc. And why there will be diarrhea? Because all that osmotically active substance will suck the water from the blood into gut, leading to hypertension, and that will increase the contractions of the gut, leading to diarrhea. Okay, and where is it very common? It is common in those who had undergone Billroth type 1 type of a reconstruction. Then what is late dumping? It occurs 1 to 3 hours after eating. ये क्यों होता है? All that food which is dumped into the small intestine, the glucose will enter into plasma rapidly from the gut. That will stimulate insulin, and that hyperinsulinemia in turn will lead to reactive hypoglycemia. Reactive hypoglycemia stimulates sympathetic nervous system, and hence they develop weakness, sweating, giddiness, which are all the features of the sympathetic overactivity. Okay, doctor? So hyperinsulinemic response is a part of the late dumping, not the early dumping. Early dumping is because of the osmotically active substances dumping. You must know the differences. Then the next MCQ of the examiner is late dumping, what is except? So high osmotic load sequestration is all the pathophysiology of early dumping. If you didn't read this topic, you are completely dumped in the earlier question and also this question. Then recurrent ulceration is least if you do vagotomy and antrectomy. Vagotomy removes electrical stimulation of the parietal cells, antrectomy removes the parietal cells themselves. So that is the reason it is, Pragya says femoral hernias are more common in women, but overall what is the most common hernia in women, doctor? Or whether men or women, it is inguinal. Yeah, that way Pragya may be right. In our reframing also is a wrong frame, because we can't say more common in women can be a feature that can happen still with femoral, na? So because their wider pelvis leading to wider femoral canal. Then doctor, most with the recurrent ulceration hota hai gastrojejunostomy alone. So like that, sometimes what happens is, even examiner's question bank also, there will be a set of some 1000 questions. For example, straight 7-8 questions computer will pick up in line and give you. If you didn't read that topic called peptic ulcer surgery, high yield topic, you are dumped. Significant side effect is most common in gastrectomy, because you are removing major part of the stomach. Common sites of the peptic ulcer hota hai antrum, which is a part of distal stomach, not the proximal stomach, is what you need to remember. More than one compartment defect is, more than one defect or compartment may be present in all these things but not in femoral hernia. No, it is not more than one. Achalasia cardia mein kya hota hai? If you do manometry, absence of peristalsis and a hypertensive lower esophageal sphincter with a raised resting pressure is what you see in case of achalasia cardia. Kellogg's triangle आपको छोड़ के कहीं भी नहीं जाएगा. Recent COMED के also you had a callot. Even this exam also you have a callot. So actual answer given by the Kerala PGMEE official is C. But ideally answer should be D. Why? Let us draw. Typically this is called as the Kellogg's triangle. This entire thing is called as hepatocystic triangle. Only this part is called Kellogg's triangle. So what are the structures that are there? You have got, this is the cystic duct coming from the gallbladder. Inferior or lateral, whatever you call it as. Then superior border is what? Cystic artery. Then you have the common hepatic duct which is basically medially located. Actually common hepatic artery is also this common hepatic artery from which left and right hepatic artery is originating. It is located medially, but that is not the exact medial border of the so-called Kellogg triangle. That is what you have to basically appreciate, doctor. But there will be no surprise next March 1st, APPG, TGPG, TNPG, if you get Kellogg's triangle straight away. 2 times we have seen recent exams. Arterial supply of the gallbladder. From where will accessory cystic artery commonly arise from? It doesn't arise from superior mesenteric artery. Let us see the story. Basically, if there is only one cystic artery, generally it will be situated in about 88% of cases. And that basically arises from right hepatic artery. Both having 2 cystic arteries is a 12% cases mein hota hai, wo situation. When 2 cystic arteries are there, in majority, both of them arise from right hepatic artery only, not from superior mesenteric artery. One cystic artery hai to wo भी वो right hepatic artery से आएगा, accessory है तो भी वो right hepatic artery से ही आएगा, most commonly. That is the point you need to appreciate. Then porcelain gallbladder. So, though it looks asymptomatic, it is asymptomatic. It can predispose to the development of the gallbladder cancer is what you have to basically appreciate. So this is how you see the presence of that calcified porcelain gallbladder. Carcinoma gallbladder, adenomatous polyps, they are generally benign, they don't have malignant potential. Whereas pre-existing gallstone disease is a risk factor. Calcification of the gallbladder is a risk factor. Any typhoid carrier like a chronic infection is a risk factor for the development of the gallbladder cancer is what you have to basically remember. But actual Kerala PG entrance mein there was a wrong frame of the question. They forgot to put except. Why I am giving the wrong frames is 4 or 5 questions even university exam mein thoda idhar udhar ho sakta. इसलिए हमारे मॉक टेस्ट परफेक्ट मॉक टेस्ट है, क्योंकि हम भी 3-4 मिस्टेक्स देते हैं क्वेश्चन पेपर की में, ताकि आपको वो एक्सपीरियंस भी हो जाए मॉक एक्चुअल एग्जामिनर का. राइट, दिस इज टिपिकल adenomyomatosis. So this is ultrasound appearance. This can be found as an incidental finding. It is a hyperplastic cholestasis of the gallbladder is the other name given for the adenomyomatosis of the gallbladder, and that lead to gallbladder thickening focally, and it is not pre-malignant. About the gallbladder disease, this is called HIDA scan. HIDA and PIPIDA, where will you use? Suppose you are having a case of cholecystitis. you want to, if your other findings on ultrasound, everything is not sure shot, nahi lag raha. So in such borderline cases, you want to prove that there is cholecystitis, HIDA, PIPIDA, imidodiacetic acid scan will basically help. So if there is any cystic duct leakage, what is the best way to treat? It is not laparoscopic clipping. So now let us look. Most of the times, whenever at the time of the procedure, if there is any biliary leakage, they will spontaneously heal if you put external drains. That's the reason wait and see policy is the one which is adopted. Suppose if it is persisting, then ERCP is the one which is indicated. Then if you look at the various types of injuries involving the biliary tree, type A injury is called peripheral leaks. So basically whenever such a kind of leak is there, then wait and watch. If it's not resolving, you do ERCP, and you can also put a short biliary stent to lower the pressure of the biliary system. Type B means main duct leak. The next step in treatment is endoscopic treatment, ERCP. Then type C injuries are post-operative biliary strictures. Then for them surgery, percutaneous balloon dilatation, stenting and endoscopic stenting is the option. Type D is transection. For them Roux en Y hepatojejunostomy, because already biliary tree you have cut to the middle. So naturally you have to provide alternative drainage by creating a hepatico-jejunostomy, Roux en Y loop you need to create to enable the drainage of the biliary system. Now doctor, black and green discharge, where do you find doctor? Whenever there is any duct ectasia. Triple assessment include clinical exam, mammogram and FNAC. Duct papilloma mein what will you do? Ductectomy is considered to be the important part of the management. Long standing goiter mein you have got a development of follicular carcinoma, as all of you know very well. Similarly, radiation exposure childhood mein huye to what will come? Papillary. Then what is the common site of the oral cancer? In case of the Indian population, you need to basically know doctor. So lateral border of the tongue, floor of the mouth and retromolar trigone area, classical Bailey and Love question. Retromolar trigone, this is the image of the Bailey and Love. Classical question. Kerala postgraduate entrance surgery survive होना बोले तो Bailey and Love पढ़ना ही पड़ेगा, वो तो पक्का है. Then what is the distressing complication of radical mastectomy? देखिए edema, lymphangiosarcoma, etc. etc. Common stone appearance without inflammatory bowel disease. Is there any entrance exam doctor? No. That's the reason Crohn's disease. Then Meckel's diverticulum. If it is broad based diverticulum, you can excise and staple the defect. You can excise and suture the defect. But you can't amputate and invaginate is not the technique which is done, unlike in case of appendicectomy, simple appendicectomy. Then pelvic abscess is the most common intraperitoneal abscess. And when do you require laparotomy? Generally you can drain it percutaneously. If you are unable to drain it percutaneously, then only indication to do laparotomy. Otherwise routinely you don't do laparotomy and put your hand into the pelvis of the patient and bring out the abscess. As a surgeon करने का जरूरत नहीं है, मतलब पेट काट के चीर के अंदर आपके हाथ लगा के, you need not do all the sewerage work. Drainage will help you. Laparotomy is only if it is not amenable. Then what is true about peritoneal mice? So doc, peritoneal mice is also called peritoneal loose body, is an incidentaloma. and usually it is only 0.5 to 2.5. They really don't grow very big. And it is the appendices epiploicae, their torsion and separation is the one which is basically responsible. Radionuclide bone scanning very helpful for identifying the malignancy. Pain is earliest in Walkmans. Medial epicondyle compared to lateral epicondyle, it doesn't contribute to the growth of the, it does not contribute to the growth of the distal humerus, unlike lateral epicondyle. And open reduction internal fixation is not the treatment of choice. Most of the times medial epicondyle injury hai to, what will you be doing, doctor? You will put one caster splint and give rest for about 1 to 2 weeks, that will heal. You don't need to do, unless the fracture shows some amount of displacement, then only it is an indication. So whenever there is multiple injuries, always airway, breathing and circulation. Non-union is because of what, doctor? Vascularity impairment, interposition of soft tissues. In fact, micromotion at fracture site is known to enhance the healing. Axial plane में अगर micro motion है तो union become promoted. That is what you have to basically remember. Then doctor, Raj is asking, how about intact fellow bone? If the other bone is intact, then in a two bone injury basically, then that malalignment also will predispose for the development of a non-union. Then what is aviator's fracture? Fracture neck of talus is basically called aviator. One eponymous name in the type of fractures: Clay Chauvelier's fracture, aviator's fracture, Rolando fracture. Without that, examiner will not be happy. One intracapsular femoral neck fracture का treatment algorithm रहता ना, when will you do arthroplasties etc. So 65-year-old with a 4-week-old displaced fracture, hemi replacement arthroplasty is the one which you will basically do. It is very quick, highly standardized procedure, and it will help early weight bearing and also help in recovery. So that is a main reason. Colles fracture is dinner fork deformity. I don't think anybody who took the today's exam would have done this wrong. अगर wrong करे तो poor prognosis. Next 10 years मिलना मुश्किल हो जाता है. तो so 140 questions, no surprise. If you cross 150 out of 200, happy. 160, oh, start partying with your friends, right? Then pre-malignant conditions, all these include but not osteoid osteoma, which is basically benign, diaphyseal, central sclerotic nidus, pain relieved by giving salicylates. Classical story, everything about osteoid osteoma, you must be ready, doctor. Oh, come on. Paget's disease leads to osteogenic sarcoma. Osteogenic sarcoma normally occur below 20. If at all it occurred above 40, that's only because of Paget's disease. How can you do such question? Wrong, my sweetheart. You should not. Then, don't forget, doctor, one question will come on this. Uchchar, epiphyseal, metaphyseal, diaphyseal. Like a Vedic Pandit, with the hair flock attached to the roof, without sleeping, be ready to do like Veda Patanam next 10 days and crack the exam and tell world you have done it. I am waiting for that, doctor. Most commonly fractured bone in the hand hota hai scaphoid. Examiner such a loving parental touch, germs area in glaucoma, if you know. Also he want to give you MD seat because he knows your limitation. How much ophthalmology you know, he knows. ऊपर वाले के हाथ में है जहां अपना, तो but glaucoma, without that no question. Cataract, retinoblastoma, retinitis pigmentosa, retinal detachment, uveitis, trachoma, Eales disease, sympathetic ophthalmitis. One question on strabismus. 10 questions are predictable in ophthalmology. Recently you attended the class by Dr. Rajaratnam, no? Excellent teacher, and she is now settled in Pune, and she is going to teach for our Pune students live classes. Then doctor, color vision, Ishaharas charts. You should be sure. Then donor cornea within 6 hours. Basic courtesy. Being a house surgeon to know these things. Snowflake cataract is diabetes. Then orbit में purulent inflammation is basically what, Dr. Orbital cellulitis. Easiest question on the earth. Glaucoma, trauma or infection leading to the loss of vision comes under preventable blindness. एक कुछ question है क्या? You can prevent glaucoma, you can prevent trauma, you can prevent infection. I mean, you can prevent blindness from any of these is called preventable blindness. Simple questions, na? This is थोड़ा repeated question. Once more. जिपर में भी एक बार आया, नवंबर में और अभी भी आ रहा है. Retinopathy of the prematurity is less than 1500 grams is what you have to basically remember. Question number 150 or 150 बहुत पीछे चले गए. We'll come back. Abnormally low position of the upper eyelid. In the entire world, I think ophthalmology examiner is mother-hearted. देखो बेटा, Cerelac खाओगे? Kind of simple question. Ptosis मालूम है कि eyelid जो होता ना नीचे droop हो जाएगा, उसको बोलते हैं ptosis. If you say, you'll get Kerala PG seat. So that's the reason. If 5-6 questions are very tough, you think, this is not my mother but stepmother who composed it. But there are 19 mothers in exam. So if one is very tough, other will be too easy going like this, right? So there is a reason, don't worry and get shaken away. You should have your own topics, doctor. That's what I am trying to tell you. आपके जब एग्जाम को जाते हैं, आपके पास 400 टॉपिक्स होना है जिसमें आप अथॉरिटी है. कुछ भी क्वेश्चन पूछा जाए आप आंसर कर सकते हैं. And 150 questions come from your 400 or 500 which is there with you. And anything that comes out of that 500, don't worry, keep going, but that 150 will come from your 500. That should be your approach, right? So, which drug is mydriatic? Once more. If you answered ciprofloxacin is mydriatic, no one can help. Options में ophthalmology examiner ciprofloxacin क्या होता है? तो it is basically cyclopentolate, 0.5%. Dehiscence of the iris from the ciliary body at the root leading to a D-shaped pupil is called iridodialysis. Catenary lever provides what gain in sound pressure? अभी आ गया stepmother. Ophthalmology too easy ना, ENT अभी शुरू हो गया. Basically 2 times. Basically if you look at the middle ear, transformer system is divided into 3 stages. आपको जब भी आवाज सुनाई देता है वो ईयर ड्रम से पास होकर अल्टीमेटली इट विल लीड टू रीच द ऑडिटरी नर्व. ईयर ड्रम catenary level. Ossicles is ossicular lever, and the surface area difference between tympanic membrane and the stapes footplate is called hydraulic lever. So catenary level में basically क्या होता है, how many times the sound pressure get altered, everything I leave the literature for you, this is too short. Articular level will provide about 2.3 and transformer level में 18:1, so you need to go through that. Bera, you must know E. coli. You remember that code, no? Mnemonic, E. coli. So type 1, type 2, type 3, type 4, type 5 waves. So Bera is an indicator of acoustic neuroma. Phantosmia means what? Unpleasant odor, continuous perception is called phantosmia. It can be a feature of schizophrenics, mood disorders, Parkinsonism, epilepsy, neuroblastoma, migrainous patients also will start feeling distinct odors. What is artery of epistaxis is easy question. Sphenopalatine artery is the artery of epistaxis and it is a branch of the maxillary artery and is what you need to remember. CT scan, Hounsfield units, easy question. Drug-induced rhinitis is caused by aspirin. Then atrophic rhinitis में क्या होता है? There will be development of anosmia. Mucocele commonly कहाँ होता है? Frontoethmoidal area में you find the presence of the mucocele. अगर otitis media and effusions are there, what is the best way? Tympanometry. What type of wave do you get in tympanometry, doctor? If there is any otitis media with effusion, type B. Type B is that flattening which you see in tympanometry in case of effusion. Then what lead to the protection against infection? Basically pH, lysosomes, mucin, they all provide the protection, not the salivary flow rate. Ectopic pregnancy, what is the most frequent symptom out of the triad of the clinical features is my question to all of you. It is the pain, abdominal pain. Preterm labor can be caused by chorioamnitis, pyelonephritis, cervical incompetence. Hypofibrinogenemia occur within 1 month, 3 to 4 weeks after the fetal demise. Then internal artery ligation, interiliac artery ligation, when will you do? Whenever there is a severe exsanguinating obstetrical hemorrhage which is beyond the control. So you will be using a non-absorbable suture. Non-absorbable suture is what you have to remember, and it will not affect the subsequent reproduction. Acute inversion may, how do you basically treat? You will reposition it, you will call anesthetic for help, and you start 2 intravenous infusion lines and etc. etc. You can give misoprostol, you can give methergine, you can use a Bakri balloon into uterine cavity, and Bakri balloon can be an image based question which can come in the exam. Then for the miscarriage, recurrently if it is happening, you will do anything but you won't accuse the husband. Semen analysis is not required. First trimester may causes chromosomal, second trimester may causes cervical incompetence. 20-year-old primary gravid at 36 weeks with a BP of 160/110. What is the next step? Next step is obviously hospitalization, evaluation and control of the BP is what you need to do. A 30-year-old, prolonged labor lasting for 18 hours and late decelerations are found with a fetal pH of 7.2. इतना होने के बाद भी अगर आप इमरजेंसी सी सेक्शन नहीं किया और आप शिमला वेकेशन पे गया, examiner also gaya, I mean patient also is gaya. So you must know all the topographic patterns, how to interpret them, head compression, early deceleration, etc. etc. 35-year-old, multiparous, 39 weeks gestation, transverse lie. Then what is the best management? Steering lagao, external cephalic version. So what are the prerequisites for external cephalic version? Basically, whenever you have a transverse lie, before 37th week you can wait. After 37th week, external version can be done. So, once the patient meets criteria, bridge presentation is there, assessed by Leport's maneuver. More than 35 weeks of gestation, first you do ultrasound and try to find that it is breech. If it is, then you check whether any exclusion criteria are there, like placenta previa. If it is there, you should not. So if they are not there, then you have to do external cephalic version. You have to calculate the version score. There is something called version score. I leave the literature for you. Less than 4 or more than 4. If it is less than 4, assess for the cesarean or trial. More than 4, you attempt external cephalic version provided gestational age is more than 37 weeks. If it is successful, congratulations. If it is failure, then you repeat weekly until 40th week. That is the simple algorithm. So what are the exclusion criteria for external cephalic version is going to be the MCQ in the next exam. Any multiple pregnancy, amniotic fluid abnormalities, uterine malformation, third trimester bleeding, uteroplacental insufficiency, any IUGR, they are all considered to be contraindications for ECV. Remember, doctor, once more, ABPG, TGPG, TNPG, you are going to have a question on ECV. Similarly, placenta previa, maternal cardiac disease, PIH, uncontrolled hypertension, fetal anomalies, they are all contraindications for external cephalic version is what I want to underscore. Coming to the gestational trophoblastic disease. After you have done the suction and treatment, during the follow-up, what do you want to do? You have to do HCG assessment. And you should tell them to not become pregnant in the immediate period. And how frequently you should collect HCG levels and monitor? Every month for first 1 year. Right? Then suppose if the patients, their gestational trophoblastic disease is at the stage 4, then monthly serum HCG monitoring for 2 years. 2 years. Then you need to ask them to practice reliable contraception. The best contraceptive method during that phase is OCPs and depoprogesterone, not the IUCD. If post-gestation trophoblastic disease contraception is practiced. That's what. No, doctor. OCPs and depoprogesterone. Why will OCPs affect the HCG monitoring? There is no such theory. Unless it's a deja vu. Then placental abruption. What is the cause of the fetal distress, doctor? Metal hemorrhage, fetal hemorrhage, uterine hypertonus. Anything can be responsible but not cord compression as a underlying cause. Best way to diagnose placenta previa क्या होता है? Ultrasound होता है. You have transvaginal, you can see, if you do an ultrasound, this is the internal os, placenta and the fetal head. Fetal head बाहर आने के लिए cervical os से placenta बीच में है. So, transvaginal ultrasound is most sensitive, 100% accuracy will be there, even transabdominal ultrasound. 20-year-old primey who had eclampsia started on max sulfate. It is a respiratory rate which you will monitor. Respiratory rate, knee jerks also, and urinary output is how you basically assess. What indicates severe preeclampsia except what? This I altered the question actually. Examiner gave proteinuria 2+. Proteinuria 2+ is not the criteria to call severe, 3+. Diastolic BP 110 or higher, not 100. So answer becomes B here. But original question was proteinuria 2+ was given in the Kerala PG entrance. One more small mistake. So the present ACOG 2012 guidelines may proteinuria is totally removed as a criteria for deciding the severity of preeclampsia. Okay, so they only depended on blood pressure. Then doctor, what is the effect of gestational diabetes? Gestational diabetes does not lead to fetal anomalies. Before becoming pregnant, if the woman is diabetic and then became pregnant, that will lead to development of fetal anomalies. But pregnancy mein first time jo gestational glucose intolerance and gestational diabetes aata na, that is not associated. This is the most confused question among all Kerala students during the exam. Remaining are all true. Macrosomia, neonatal hypoglycemia, shoulder. By elimination you can answer actually. Then which drugs close the placenta? Heparin doesn't. 25-year-old with type 1 diabetes want to start the family. What is the most important measure to be initiated? There are some subset of populations folate is prescribed antenatally only. I mean before becoming pregnant only. What are those situations, doctor? American Academy of Pediatrics say all women capable of becoming pregnant should consume 0.4 mg folic acid per day. Anybody who is in reproductive age group who is a potential to become pregnant. And if there has been previously affected pregnancy, then 4 mg per day before conception should be started. Then there are high risk groups like positive family history, type 1 diabetes, seizure disorders treated with valproate, or who themselves have neural tube defects. They should also consume 4 mg per day. Diabetes type 1 is included in antenatal and also prenatal folate administration protocol. 28-year-old women who is a primary gravida of 10 weeks gestation with severe lower abdominal pain. Uterus is tender. That makes the diagnosis of a ruptured ectopic pregnancy as a possibility. 28-year-old, the disadvantage of a midline episiotomy kya hota hai? Favorite repeated question. Don't you agree with me? 30 out of 13 obstetrics gynecology तो आना ही पड़ेगा अगर आप फर्स्ट 100 रैंक्स में बैठने का ख्वाब देख रहे तो. Midline versus mediolateral, you must know the differences. Midline is easy to repair, minimal post-operative pain, good anatomical result, least blood loss, rare dyspareunia, and extensions but are common. Straight away it can go and involve the rectum, so it can extend. एक percentage वाला question examiner, leave it to God, Venkateshwara, Tirupati, Govinda. So 30 to 50%, it is not in your hands. Don't disappoint if this is the first question. Predisposing factors for endometrial cancer include late menopause and early onset of puberty. Then Mirena basically has got the Mirena loop, it's called. So it has got levonorgestrel containing intrauterine contraceptive system. It thickens the cervical mucus, it makes the cervical sperm disappointed, endometrium is suppressed, not much of effect on ovary. Late menopause is defined as what? Actually Kerala official key mein they gave it as 52 years, but actual answer is 55 years. Beyond 55 years becomes the correct answer. Postmenopausal bleeding, basically what is the etiology? Cervical polyps, anal vaginitis, anything, not using the combined OCP. Then what is the best method of emergency contraception in nulliparous women? Emergency contraception. Levonorgestrel is called the morning after pill, is the name which is being given for it, is what you have to basically remember. Sir, 181 question, even cord compression can cause fetal distress normally, but that is not the one predisposed by the abruptio. Abruptio means what? Retroplacental bleed. Retroplacental bleed. Waha fetal distress hai to the causes are like lot of bleeding happened, etc. etc. I think Kalyani is convinced with that answer. 20-year-old unmarried girl is diagnosed with PCOD with hirsutism. Hirsutism hai to you will use cyproterone acetate. What is the mechanism, doctor? It is a synthetic steroidal anti-androgen progestin and anti-gonadotropin is what you have to basically remember. Use it in prostate cancer, precocious puberty, etc. etc. So, idiopathic PCOD, Cushing, they are all the causes of the hirsutism, not the warfarin, is what you have to remember. 23-year-old, clue cells means what is your answer, doctor? Gardnerella. Candle vaginitis lead to Cardi discharge, not for a yellow-green discharge is what you need to remember. Copper T380A, 10 years. 1 decade is what you need to understand. So, doctor, we still have 10 more days for the March 1st. Defiance with defeat and magnanimous with victory, said the Winston Churchill. So also, doctor, next to 10 days, only one dream of being a successful postgraduate of your dream branch must be the driving force. Good luck. Manasa is asking question number 170. Just go to 170 question. Let us check. What is the alternative answer of Manasa? Please punch your alternative answer. Kalyani says 156. What is the option? We will come to that. Manasa should tell 170 what is the alternative answer she thinks. Can reliably attribute it to protection against infection. Oh, no, the only, sorry. No, pH, mucin and I'll come back. I mean, I need to check the role of the salivary flow rate. Actually, those who have xerostomia in Sjogren's syndrome, they will have dental caries. Maybe out of all this, the proven factor may be salivary flow rate. I'll just recheck the answer and come back on that. 170 could be reasonably right. We'll check that. Then, question number 156. Can you go to 156? Yeah, glaucoma, this is preventable blindness, no? Avoidable is different from preventable. Except in pregnancy, we are talking about blindness. What is preventable? Avoidable. Preventable means glaucoma आ गया, trauma आ गया, infection आ गया, फिर भी आपने infection को control किया, trauma को handle किया, glaucoma को properly treat किया, ताकि आप blindness को आने से prevent किया. So that's the point. Shaz is saying why not be treatable? These are all very, very closely linked definitions. आप खुराना ophthalmology open करे तो he will one page में he will define all these things. Trauma you are not preventing, you are preventing blindness due to trauma. That's the point. Anyway, thank you, doctor.